Hello everyone and welcome back. Today we're going to be talking about your pelvic floor. So this is especially important for any of my mamas out there, but pelvic floor work is also something that we should just consistently be doing, kind of as like a maintenance technique, as something that can get weaker with age, injury, posture, etc. So I've got a pretty informative video laid out for you guys today. I am by no means an expert. I'm a certified Pilates instructor. I am a mother myself. I'm pretty recently postpartum. My son is almost 5 months old at this point. And I just think that this is something that we don't talk about a lot. Not many mothers that aren't in the fitness world maybe know about this. You know, you have your kid, your doctor says take it easy for 6 weeks and they kick you out the door. So we're gonna talk a little bit about that. I'm gonna show you some anatomical images, and I am going to be using anatomical phrases to refer to female genitalia as well today, so hopefully I don't get in trouble for this, but if I did, hey, it was in the name of education. So first I'm going to go ahead and show you some pictures in my textbook so you know what we're talking about. So first thing I'm going to show you is just the skeletal anatomy of your pelvic floor. So this is your pelvic floor right here. These are your hip bones. These are your sits bones. These are what you sit on. So this is what the female one looks like. You have this little inlet here. That's where the baby comes out of. Just to kind of give you a basic understanding, because I'm going to show you the muscular one next. So I just wanted you to kind of be able to place in your mind what I'm talking about. So here we go. Here comes the very explicit racy image. Woohoo! There it is. This is your pelvic floor. So this big muscle right here that we see, that is your levator ani. That's what supports your pelvic organs. It's like a hammock or a sling. This, all along these little tendons along this area, this is your perineum. This is what can get damaged if you have a vaginal birth and can get torn. So that's essentially those. Your perineum also helps constrict like your urethra and is responsible for your bladder control. So some of the functions of your pelvic floor, it helps stabilize you. It's part of your postural muscles. It keeps your hips in line with your spine. It also supports your sexual organ functions. Without those muscles, we wouldn't have orgasms. That's just a fact. It's also for breathing. Your pelvic floor is part of the kind of sump pump that your entire core is. So how does pregnancy specifically affect our pelvic floor function? Well, as you can imagine, there's a lot of pressure on that pelvic floor, on that sling throughout pregnancy, especially as we progress. During delivery, your pelvic floor muscles actually will stretch 1.5 to 3 times their size. And as some of us mamas know, if you had a vaginal birth, I didn't myself, but if you did, sometimes those perineal muscles can get stretched and torn during delivery. Another way that they are affected is when you're pregnant and when you're breastfeeding, you have this hormone racing through your system called relaxin. It helps relax your muscles, your tendons, your joints. That's why we sometimes get a little bit of that waddle towards the end of our pregnancy. And that stays in your body until about 3 to 4 months after you stop breastfeeding. So while you're breastfeeding, while you're pregnant, you still have that relaxin, so you will still feel like the effects of that. Just kind of a looseness in the joints, or maybe you feel really flexible. Please don't test your flexibility at this time. It is not a good time to try that because you could hurt yourself. So a lot of the times we're told after 6 weeks, after we have our baby, we're good to go. You can get right back to your exercise, you can do what you want, you can have sex. That's not the case. And I'm sure, as most moms will tell you, at 6 weeks postpartum, sex is the last thing they want to do. More likely for a vaginal delivery, that tissue recovery takes about 4 to 5 months. And if you've had a C-section, your tissue is still affected, albeit a little bit differently. So you didn't have quite that like almost blunt trauma that delivery is, but you've still been stretched out in that pelvic floor muscle region. You still have that relaxin coursing through your system. So for a C-section can take anywhere for your muscle, your tissues around that incision, about 12 to 18 months actually to heal. So what is pelvic floor dysfunction? I might refer to it as just PFD. It's a little easier to say. So simply put, it's just the inability to correctly tighten and relax your pelvic floor. What can happen? So some symptoms. How do I know if I have it? You're peeing a little when you sneeze, coughing, laughing, jumping, or running. We should not, it's common, but it's not normal. We should not have to cross our legs really quickly every time we feel a sneeze coming on. You might have some pain with intercourse. You might have an inability to feel like you fully emptied your bladder. You can be constipated, or on the other side, you can have a fecal urgency. You might be rushing to the bathroom and spending a lot of time there. You might feel kind of this heaviness in your vagina, almost, I've heard it described, I've never experienced myself, but I've heard it described as a feeling like a tampon is slipping out. And that is actually a sign of pelvic organ prolapse. And if you are feeling anything like that, if you feel that heaviness, please talk to your doctor, because that requires a lot of one-on-one work with a pelvic floor physical therapist. So please talk to your doctor if you're experiencing that. Another really common sign that we don't really think of is associated with our pelvic floor is a consistent lower back pain. And that's because when your pelvic floor muscles are weak, it affects your posture. I have some notes down here. So, should you see a doctor or physical therapist if you have these problems? Absolutely, any of them. No matter how mild, see your doctor. I know that the postpartum care here in America is really lacking. Medical professionals feel that way too. It's not just us as patients. So yes, please demand a pelvic exam after you have a baby, or even if you're feeling these experiences as well. This can really help you find your areas of weakness in your pelvic floor. So for example, my anterior pelvic floor, the one in the front of my body, is a little weak, and I've been really focusing on that. So once you know where those areas of weakness are, you can kind of tweak this little routine that I'm going to put together for you here in a couple minutes to really focus on your areas and where you need to work. And be persistent. Sometimes I know doctors will be like, oh, well, okay, just do Kegels for 6 months and then we'll talk about it. No, be persistent. Annoy them if you feel like you need to. You need a pelvic floor exam. Anybody that has a baby needs a pelvic floor exam. Explain your symptoms. Please don't give up. Another thing we're going to talk about is Kegels specifically. We think of Kegels just kind of as, tightening those muscles like when you pee, but a lot of people tend to do them incorrectly. So when I'm talking about a Kegel, I want you to imagine you're lifting that pelvic floor, almost like an elevator. You feel almost this like scooping motion. And we're going to talk about that a little bit more here in a couple minutes when we get into that routine. So this routine that I have planned out for you, ideally, you should do this daily, and it should only take a couple minutes. We're just going to do 10 of every exercise and breathing exercise. If you don't have time to do it daily, I understand. I'm a mom too. Please try to do it about 3 to 4 times a week, and just be consistent with it. Even if you don't get to do it very often, just be consistent. It's never too late to fix a pelvic floor dysfunction, whether you're 6 weeks postpartum or you're 6 years postpartum. You can absolutely make a difference in your way of life. So we're going to go ahead and get started. I'm going to scoot back here. We're going to start with some breathing. So remember I mentioned that pelvic floor is kind of part of that sump pump. So we're going to start with some diaphragmatic breathing. Your diaphragm is right down here in your rib cage. So we're just going to breathe really, really wide. Let everything go, everything relax. And as you exhale, I want you to lift up from that pelvic floor, go into what that kind of Kegel motion would feel like, lifting up and feeling that core really come together here, knitting in the middle. So everything gets really tight when you exhale. We're going to do 10 breaths here. So nice deep inhale, everything relaxes. And exhale, start at the pelvic floor and then zip all the way up. I like to do it nice and loud. Go at your own pace. You don't have to follow my breathing if that doesn't feel natural for you. Just 5 more here and we'll move on to our elevators. If you're not comfortable sitting, you can do this standing, laying down. It's up to you, even in a quadruped position. And if you're just starting out, you can always do this in a chair, have a little back support. 2 more here. All right, we're gonna move on to our elevators. Same nice deep inhale, relaxing everything. As we exhale, we're gonna lift that pelvic floor 1, 2, and 3 floors, and we're gonna hold it up at the highest for the rest of our exhale. Once you're at that top floor, I really want you to focus on that area of weakness if you know what it is. So for me, like I mentioned, it's that anterior pelvic floor. So I really focus all of my attention right there in that anterior pelvic floor right towards the end. So let's go ahead, we're gonna have 10 of these as well. And inhale and relax. And as we exhale, we're gonna lift up 1, 2, and 3. Hold it there till you're done. And inhale, release. Perfect. Go ahead and continue through those. We're halfway there. Last one here. And we're done with our breathing exercises. That's all for that portion. You can also easily fit those into your day while you're pumping. That's a great option. Sometimes I did that when I was still pumping. So we're gonna go ahead and move into a quick little routine here. I'm gonna be laying on the floor. I'm on my mat. We're gonna go into some pelvic rocks here. So I want you to imagine you have a marble right here on your belly button. As you exhale, you're gonna tuck this pelvis forward. Bring it up towards your belly button. That little marble is gonna roll up towards your chest. And as we inhale and we relax that pelvic floor, we go ahead and lower it back down. Marble goes back to its starting position. You're gonna feel a little bit of a space underneath your low back and the floor. So we're gonna do 10 of those here. Nice deep breath to begin. Exhale, engage that pelvic floor, engage that core just like we were doing in our diaphragmatic breathing, and tuck that pelvis in. Inhale and relax. Another thing I want you to focus on here, as we tuck that pelvis up, don't use those glutes. I really want your core and your pelvic floor to do the work here. If you feel those glutes turning on, try your hardest to keep them off. This style of breathing is what you should be doing whenever you're lifting anything, including your baby, the car seat, even a laundry basket. Always focus on activating that core and that pelvic floor before you lift. Last one here. All right, we're gonna go ahead and move into our bridges. We're going to stay in this position. Nice deep inhale to begin. Exhale, engage that pelvic floor, engage that core, and we're just going to lift those glutes up to the ceiling. Keep that pelvis tucked under just a little bit. After having a baby, we tend to have an anterior pelvic tilt, which is a fancy way of saying we tend to stick our butts out because you've been pulled in that direction for so many months. Now you will feel the glutes activate here, but I promise we're still working that core and that pelvic floor as well. Halfway here. Two more. On this last one, we're going to go ahead and hold it up at the top. Perfect. We're just going to take our legs out and back in, just like you have a little butterfly flapping your wings. Engage as you take those legs out. Inhale back to the start. 10 here. We've got 4 more here. Last 2. And 10. All right, we're gonna go ahead, roll over onto our side. This is our last exercise. We're gonna do this on both sides. Top leg, well, let me start with the head. Head, we're gonna have resting on our bicep. Top leg is going to be floating just in line with that hip. I don't want it all the way up here. If you feel like this hip bone is coming in towards your rib cage, you've gone too far. We just wanna keep it in line here. We're going to lift and lower our bottom leg to meet our top. We're gonna do 10 on this side. I'll flip it around, I'll do 10 on the other side. Inhale to begin. Exhale, engage. If this is uncomfortable on your bottom hip, feel free to add a little cushion there. You can double up your mat. You can add a little towel. 2 more. Last one. All right, let's go ahead, flip it around. We're gonna do that one last time on the other side, and then we will be all done with our quick pelvic floor routine. So again, top hip just in line with that hip, or top leg just in line with that hip. Nice deep inhale, and we'll go for 10. We've got 8, 9, and 10. And that is it. That's just a quick routine. You can find just a few minutes for yourself within your day just to do that. You could even do it before bed, first thing in the morning. I hope that that helps. I hope that I gave you a good explanation of your pelvic floor dysfunction. If you have any questions at all, please leave them for me in the comments below. I will try my best to address them. Like I mentioned before, though, I'm not an expert. I'm just someone who has experienced this myself, and I am a certified Pilates instructor, so I do have a background in sort of muscle dysfunctions. So that is it. Thank you so much. Have a great rest of your day. Have fun.